Do you cringe when it's time to write goals and objectives? Is your least favorite part of being a music therapist writing goals and objectives? Imagine that there's a key, something you can do to make your music therapy practice better. Something simple that you can do that helps you as a clinician, your clients, their families, your employer, granting agencies, and insurance companies. Well, conceiving of and writing appropriate and constructive goals and objectives will make your practice more efficient for you and more effective for your clients, their families, your employers, insurance companies, and granting agencies. My name is Jeffrey Friedberg. I'm a board-certified music therapist, a New York State creative arts therapist. I perform and record music for children and families with the Bossy Frog Band, and I have over 20 years' experience providing music therapy to children, teens, and adults. I currently run a music therapy private practice in Nyack, New York called Music for Life Creative Arts Therapy. In this presentation, we will cover the why, who, and hows of writing goals and objectives. This presentation will both demystify the process and provide you with definitions, a simple formula, and the do's and don'ts of writing goals and objectives. For starters, why do we need to know how to conceive and write goals and objectives? What is the purpose? Then we'll cover who. Who are we writing for? Who benefits from our writing quality goals and objectives? Who is the audience or recipient? And finally, how. How do we write goals and objectives that benefit everyone involved in the therapy process? What is the best format? What to include and to not include? But first, a quote from the great philosopher of our time, Yogi Berra. Quote, "You got to be careful if you don't know where you're going because you might not get there." End quote. As music therapists, we need to know where we are going in order to be able to get there. Where we are going, also known as our destination, is the goal, and the route we travel are the objectives. As clinicians, we need to know the destination of the treatment or the goals in order to choose appropriate directions, the interventions, and how to evaluate treatment and know when treatment is successful. Otherwise, we risk traveling aimlessly. The same goes for our clients, their families, and other therapists on the team. We all need to know the goals of the treatment and to agree with the goals in order to successfully and effectively work towards learning and growth. Therapy is not a guessing game. Goals and objectives are an essential part of music therapy. Knowing how to write well-conceived goals and objectives are an important skill. With that said, let's start with why. Why do we need to know how to write goals and objectives? Well, first off, we need to know how to write goals and objectives in order to maintain our certification. The Certifying Board for Music Therapists tells us that knowledge and skill in writing goals and objectives are important in order to keep our MTBC. Goals and objectives are a primary category under treatment planning as listed by the CBMT in their list of music therapy domains 2015. If you want to keep your certification, then you better know how to write goals and objectives. The CBMT writes that under the heading of treatment planning, music therapists need to be able to establish client goals and objectives that are achievable, measurable, realistic, specific, and time-bound. But goals and objectives are much more than just a mandated skill that we must acquire as music therapists. They serve a positive role that affect treatment outcome. They are essential to the therapy process. Knowing how to conceive and write goals and objectives help the therapist, the client, the families involved, and other professionals involved in the process. Well-conceived goals and objectives provide three main functions. The first, they direct the therapy. Well-conceived goals and objectives tell us where we are going. They guide the treatment for the clinician as well as the client. As I mentioned in a previous slide, as clinicians, we need to know what we are trying to accomplish in order to choose appropriate interventions and to evaluate treatment as to its effectiveness. Clients need to know what the goals are in order to know what to work on and what it looks like when they are successful. Families need to know how to help the process, what the aims are, and how to facilitate learning. Other professionals need to know what we are doing so as to not work at cross purposes or duplicate treatment, or how to reinforce work done in each modality. Well-conceived and written goals and objectives direct the therapy. They guide us as to what we are trying to achieve and how to attain the goals. Imagine driving without knowing the address of where you are going. You drive aimlessly, hoping you'll magically drive on the right combinations of roads and show up at your destination wherever it is. There's a high probability that you would drive in circles or get lost or end up where you started. The address is our goal. It's where we want to go. Or imagine knowing the address of where you want to go, but not having a map or GPS to show you the combination of roads and bridges to get there. In this example, the roads we travel on, the directions to get us to our address, are the objectives. The objectives are how we get to our goals. In addition to directing the therapy, goals and objectives also provide the foundation for the therapeutic process. Without a well-conceived and thought-out plan for treatment, we risk building something that clearly functions poorly and might fall down or not stand up in the first place. With a strong foundation, well-conceived written goals and objectives, we can build something sturdy that will last. The therapy process is essentially a four-step process. Step 1 is the assessment, when we assess a client's strengths, challenges, and needs in order to conceive appropriate goals and objectives. We need to know what brings the client to therapy. What are the presenting problems as well as skills and strengths? In step 2, the treatment planning, we plan the treatment based on what we learn from the assessment. In step 2, we decide what the goals, objectives, and interventions we should use to get there are. During step 3, the treatment, we provide music therapy based on the goals and objectives listed in the treatment plan, conceived from what we learned in the assessment. In step 4, we reassess and evaluate the goals, objectives, and interventions. What is the progress? Are goals, objectives, and interventions as written appropriate and helpful? Do we continue along the same plan or adjust the treatment plan, including the goals and objectives? We circle back to step 1 to reassess and review the treatment plan and then continue to provide treatment based on our evaluation. The goals and objectives provide the foundation for this process. Well-conceived, written, and applied goals and objectives provide a strong foundation upon which to build the treatment. Without clear and well-conceived goals and objectives, we risk building a house on a poor foundation, or one that does not function as intended. Goals and objectives are also used to justify the therapy to our clients, their families, our agencies and employers, and to the public. Well-conceived and written goals and objectives demonstrate the effectiveness of the therapy by clinically outlining the desired outcomes and allowing for clear understanding of how and when treatment is accomplished. Clients, families, and agencies need to know expectations of therapy and when outcomes are achieved. As clinicians, we need to be able to articulate a clear plan of what the therapy is trying to accomplish in order to collaborate with clients, their families, other clinicians, and agencies. And whether we receive funding from clients out of pocket, from insurance companies, work as employees in an agency, or through contracts or grants, we need quality goals and objectives in order to justify the treatment. We need to be able to communicate what we are trying to achieve and how we will evaluate progress and success. Are we effective in the treatment we provide? Clients need to know how the therapy is going to help them achieve their goals in a clear and truthful way. Families need to know that there is a purpose to the work and how the treatment plans to get there. Agencies need to know that there is a clear plan and how the limited resources of time and staff will be spent in the pursuit of those goals. And insurance companies and granting organizations want to know the justification for funding the treatment. Well-conceived and written goals and objectives provide that justification along with outcome studies based on the goals and objectives. But what exactly are we talking about when we say goals and objectives? These are terms that are often confused and misused. So before we get to the who and how of goals and objectives, let's review the definitions of goals and objectives. There are common misperceptions about what goal and objective refer to. Some people think these terms are interchangeable, but they're not. While they are often mistaken for each other, goals and objectives each mean something different from the other. They are related and work together, but they mean different things and provide different functions in terms of treatment and lesson plans. Goals are general. Objectives are specific. Again, goals are general. Objectives are specific. The goal is the broad or general area of improvement, learning, or growth. Again, the goal is the general area of improvement, learning, or growth. Here is an example of a general goal for reduction of symptoms of depression. The general area of improvement is, quote, symptoms of depression will be significantly reduced and no longer interfere with functioning. Again, the general area of improvement is, quote, symptoms of depression will be significantly reduced and no longer interfere with functioning. Objectives are specific and desired outcomes. The objectives are specific actions that demonstrate the goals have been attained or what the client will do to attain the goal. So to return to our goal of, quote, symptoms of depression will be significantly reduced and no longer interfere with client functioning, the objective for this goal are listed as specific and desired outcomes, including the development of a safety plan by Jill and father, client engaging in one extracurricular activity, client reporting no suicidal ideation for 3 consecutive weeks. Those are the objectives that are specific and desired outcomes. So let's take a second and ask yourself, can you see self-esteem? Can you see self-esteem? The objective is what you really set out to accomplish in treatment. The goals are the broad or general areas of improvement, learning, or growth, such as increased self-esteem. So the goal is to increase self-esteem, but the objectives are specific and attainable. You have to be able to see them. Let me read this quote. It describes goals and objectives in an easy to understand manner. Quote, an objective is a specific skill that the patient must acquire to achieve a goal. The objective is what you really set out to accomplish in treatment. It is a concrete behavior that you can see, hear, smell, taste, or feel. Again, it is a concrete behavior that you can see, hear, smell, taste, or feel. So improving self-esteem might be the goal, but the objectives are what the client will do that you can see, hear, smell, taste, or feel that are the specific objectives. To continue the quote, an objective must be stated so clearly that almost anyone would know when he or she saw it. Goals usually are abstract statements that you cannot actually see happen. You cannot see someone learn or see his or her self-esteem. However, you can see an individual express 10 positive things about him, herself, or herself, end quote. As this quote from Diffin.com starts, the word goal and objective are often confused with each other, end quote. Both are the desired outcomes of the therapy work, but what sets them apart, what is different about goals and objectives, is the time frame, attribute they're set for, and the effect they inflict. But the course goes on to talk about who we are writing for, goals and objectives for, including the therapist, the client, agent, your employer, granting agencies, insurance companies, and how to write SMART goals in music therapy. We will spend a majority of the time talking about ways to write goals. So I hope to see you at the course, and thank you for listening to the preview.